My name is Dr. Rachel Cady. I'm a OBGYN practicing in Crosby, Aiken, and Mora, Minnesota. And I wanted to take this opportunity to visit with you today about heart health as it relates to women, particularly given that it's American Heart Month this month for February. So wanted to highlight some of the differences between women and men's heart health, some of our common risk factors, some unique facts, role of estrogen, and how to be your best advocate moving forward. So what we do know is that heart disease is a leading killer of women, the leading cause of death in women. And when you survey women, most do not know that. Most women think that it's cancer-related deaths that are the number one killer of women, and that is simply not true. So I think that there's definitely a role for education and just highlighting some of those things. I'll also mention that some of the points that I'm bringing up in this really brief video are also listed on our website, cuyunamed.org, under our blog, so you can refer to that too. Just some short little information. We also know that most women, when you ask them about their individual heart disease risk factors, they don't really think that they have that many heart disease risk factors, and the average woman does have quite a few. So I want to highlight some of that as well. We know too that when a woman has a heart attack, she's more likely to die within a year compared to when a male has a heart attack. So there are some sex-related differences. And also, when a woman has a heart attack, her symptoms are oftentimes more vague than that of a male. And so having that, blockage in your heart, kind of that crushing chest pain, left-sided, radiating down your arm, that's more common for men than women. Women tend to have more microvascular disease, small vessel disease, so their symptoms might be a little bit more vague, but certainly just as important. So they might have more nausea or just not feeling well. You really need to be your best advocate for that. Another point too is that most heart specialists will tell you that they can see a heart attack coming for a patient about 10 years before the actual event. So our trajectory for life choices, particularly in our 40s and our 50s, are really it's a big thing as far as how we proceed with the rest of our life and some of the things that we can do. So one sort of calculator for figuring out our individual heart disease risk factors is something called the ASCVD risk factor. And that takes into account, it's like a formula, it takes into account our age, our blood pressure, cholesterol, those kind of things. And it gives you kind of a general score of what your 10-year risk factor would be. This is something that your primary care clinician can guide you with as well. And it therefore makes some recommendations, like do you need a lipid-lowering medication? Do you need some specific testing? Those kind of things. But what isn't included in that calculation is things that really are unique for women, because most heart disease studies have been traditionally done on men. So those unique factors for a woman are not calculated in that little formula. So when you're seeing your primary care clinician, you really need to let them know if you're somebody that had a history or has a history of polycystic ovarian syndrome, as that's a big risk factor, past history of preeclampsia or high blood pressure in pregnancy, an early menopause, meaning periods stopping before age 40, that's also a risk factor for heart disease. Certainly knowing your family history, diabetes in pregnancy, all those kind of things are, we know, big risk factors for heart disease, but aren't nicely included in that formula. So really being your best advocate for that and letting your primary care clinician know too. Also, as far as what are some common things between men and women, and a lot of these are a little bit more well-known, certainly well-established, is the importance of smoking cessation and really understanding that it's never too late to quit smoking. Weight control. The average woman gains about 1 to 2 pounds a year in menopause, and that's something that if you know that and are proactive with that to kind of stop that slippery slope. And more women are obese than men, and so knowing that that is a risk factor and really being proactive with that, having about 150 minutes of some sort of physical activity in a week And actually really looking at how much you're sitting too is a big risk factor as well. So if there's just some modifications you can make, like standing at work instead of sitting at your desk, those kind of things really does play a big role. We talked a little bit about weight importance too. Diabetes as well. It's interesting that women with diabetes have a bigger risk factor for heart disease compared to men with diabetes. Both are concerning, but it affects women more negatively than diabetes affects men as far as it relates to heart disease, if you look at kind of general populations. The other thing too is certainly, this comes up all the time as far as what diet is best for women for heart health and just general health. And over again, that Mediterranean diet really wins out. Certainly there's others that are great. It's people talk about it's the one that you are most likely to stick with, whether it be Weight Watchers or DASH diet. But really looking to at those added sugars, you're looking at about less than 26 grams a day. So kind of all these little pieces that really, are doable and are things that we have to decide for ourselves. As far as the role of estrogen in heart disease, this is really kind of a hot topic and is something that's currently being studied quite a bit and actually has been looked at in other studies recently, and for example in the ongoing Women's Health Initiative and some ongoing nurses studies. What we do know is that there is some prevention seen of heart disease for women in their early menopause or in their late perimenopause, meaning that those years leading up to menopause. If they're taking estrogen, that probably is somewhat helpful in preventing heart disease. Now, it's important to note that it is not recommended to start hormones just to prevent heart disease in these patient populations, again, in that early menopause or late perimenopause years. For most women, that would be in their late 40s, early 50s. But it does seem to have some heart protective effects. That is not the case for women in late menopause, meaning they're greater than 10 years out from the time of their menopause onset. So primarily women in their 60s. We don't see those same benefits. But certainly there are some benefits seen as a result of taking estrogen with that. So in summary, I wanted to just highlight the incidence for women, that this is the #1 killer of women, heart disease, and that a lot of it really is modifiable. There's new guidelines from the American Heart Association as well, and you can certainly look at their website, but being really proactive with getting your blood pressure checked every year, as well as your cholesterol checked every year, knowing your own risk factors, knowing some of the individual risk factors for women, primarily as it relates to menstrual history and pregnancy, knowing your family history, and also, I think very importantly, knowing that heart disease is a little less obvious in many women than it is in men. And so if you're not feeling right, you really want to be your best advocate to your primary care clinician. And thank you so much for your time.